Infection with HIV. Infection with HIV caused by human immunodeficiency virus, that attacks the immune system and can lead to AIDS. HIV causes a gradual weakening of the immune system, making the infected individual more susceptible to life-threatening infections and cancers. The most common way to contract HIV is through sexual contact. However, it can also be transmitted from a mother to her child during pregnancy, childbirth, or breastfeeding. Additionally, it can be contracted through the sharing of injection tools, such as needles. According to the World Health Organization, there were approximately 38 million people living with HIV globally in 2019. Causes of HIV infection. HIV is caused by the human immunodeficiency virus, which attacks the immune system. The virus is primarily spread through sexual contact with an infected person, sharing of needles with an infected person, and from mother to child during pregnancy, childbirth, and breastfeeding. We have to know that people who have HIV acute infection can still infect others, so it's important to take precautions to prevent transmission, such as using condoms and avoiding sharing needles. Symptoms. HIV can cause a wide range of symptoms, but many people do not experience any symptoms at all during the early stages of infection. Symptoms of acute HIV infection can include fever, fatigue, sore throat, swollen lymph nodes, rash, and muscle aches. These symptoms may be mistaken for the flu or another viral infection, and some people may not experience any symptoms at all. The symptoms usually appear within 2 to 4 weeks after exposure to the virus, and can last for several weeks to a few months. During acute infection, the virus is highly contagious and can be easily transmitted to others. This is because the virus is present in large amounts in bodily fluids, such as blood, semen, vaginal fluids, and breast milk. Additionally, people with acute HIV infection may not yet have detectable levels of HIV antibodies, which means they may test negative for HIV even though they are infected. The stages of HIV infection. HIV infection is a progressive disease that advances through 3 stages: acute HIV infection, chronic HIV infection, and acquired immunodeficiency syndrome. Without treatment, the virus will continue to weaken the immune system, making the individual more susceptible to other infections and diseases. Stage 1. It is the initial stage of the disease, which occurs shortly after the virus enters the body. Symptoms of acute HIV infection can include fever, fatigue, sore throat, swollen lymph nodes, rash, and muscle aches. These symptoms may be mistaken for the flu or another viral infection, and some people may not experience any symptoms at all. Stage 2. Also, it is known as asymptomatic HIV infection or clinical latency, is the second stage of the disease. During this stage, the virus continues to replicate at a lower level, causing damage to the immune system over time. However, most people do not experience symptoms, and the virus can remain undetectable for many years. Is the most advanced stage of HIV infection. During this stage, the virus has severely damaged the immune system, making the individual more vulnerable to other infections and diseases. Common symptoms of AIDS include weight loss, chronic diarrhea, and neurological disorders. Diagnosis. HIV can be diagnosed through rapid diagnostic tests, in a medical laboratory, that provide same-day results. This greatly facilitates early diagnosis and start of treatment and care. People can also use HIV self-tests to test themselves at home. If the test is negative, this means the person is not infected, but the case is different with positive results. No single test can provide a full HIV positive diagnosis. Therefore, confirmatory testing is required. There are 3 test types for diagnosis. HIV can be diagnosed with a blood test that looks for antibodies to the virus. Antibodies are proteins that the body produces to fight off the virus. Another blood test is to detect the viral antigen P24. Also, a test can be done to detect the genetic material of the virus, called RNA test or PCR test, which is also known as the viral load. If the test is positive, a follow-up test will be done to confirm the diagnosis. Diagnosis of acute HIV infection can be challenging because the symptoms are similar to other viral infections, and the virus may not yet be detectable in standard HIV tests. Treatment of infection. If the infection is detected early, antiretroviral therapy can be started during this stage to help prevent the progression of the disease and reduce the risk of transmission. HIV is a chronic illness that cannot be cured, but it can be managed with antiretroviral therapy. ART is a combination of drugs that work together to slow down the virus's ability to reproduce. The goal of treatment is to reduce the viral load to undetectable levels, which helps to keep the immune system strong and lower the risk of transmitting the virus to others. Antiretroviral therapy, which is a combination of drugs that work to slow down the virus's ability to reproduce. It is also important to maintain healthy lifestyle habits, such as eating a balanced diet, getting regular exercise, and managing any other health conditions you may have, to help keep your immune system strong and improve your overall health. Conclusion. HIV is a serious global health issue that affects millions of people worldwide. Shortly after infection, the person may experience symptoms. This is called acute HIV infection or early stage of HIV. If treated early and properly, the patient can live a healthy and long life. But unfortunately, the HIV cannot be cured. While there is no cure for HIV, it can be managed with antiretroviral therapy, which can help to keep the virus at undetectable levels and lower the risk of transmitting it to others. Infection with HIV.